to introduce our speakers today. First is Michelle Hall. She is a nurse of cardiac rehabilitation services at Sutter Health CPMC, and her team works to reduce patients' risk for future heart problems and also aid patients recovering from a heart attack or surgery by connecting them with cardiac experts, cardiac rehab experts. One example are registered dietitians, which is a great segue into our other speaker, Jason Mousel, who is a registered dietitian at Community Health Resource Center, and he takes a whole body approach to nutrition, helping his clients create personalized, well-balanced eating to achieve a healthy weight, optimize energy, decrease struggle with food, and meet nutrient needs.
Okay, I'm going to actually launch a poll before I begin my presentation.
What was the leading cause of death last year in 2020? The 4 options are COVID-19, heart disease, cancer, or suicide, and you can choose one of those 4 choices.
Okay, so I'm going to end the poll right now. Thanks for answering the question. And the majority of you, 71%, have answered heart disease, which is actually great because that now I'm able to actually share my my screen. So yes, heart disease remains to be the leading cause of death in the United States. There's a lot of attention to COVID, and COVID is very real and very prevalent in the United States, but it now moved up to number 3 in the United States for 2020. I don't have all the data for 2021 with this new variant. That might actually change, but as you can see, these numbers are still pretty high for heart disease. We have patients that have bypasses, stents placed, and even deaths, cardiac arrest. And this is what I'm going to be talking about today. So as you can see, this was actually taken out of an article that I read earlier this year from Forbes. And I was really surprised this was actually put together by the CDC, and happy to see that that puts us into perspective as to how COVID has really jumped up. In previous years, flu and seasonal flu was much lower down this list and wasn't actually put in as far as COVID is concerned. But I thought it was pretty relevant just to see how important it is for us to keep addressing heart disease. So, okay. I wanted to talk about heart attack symptoms. So we have very typical symptoms, and we have also atypical symptoms. I basically started off with putting the heart attack symptoms first, and then I'll talk about the symptoms that females experience because it is actually different. So typically when somebody has an actual heart attack, they are going to feel a variety of these symptoms that you see on the screen. It could be chest pain, it could be a strange feeling in the chest, it could be shortness of breath, it could be pain, pressure in the back, neck, jaw, upper belly. You can experience heartburn or abdominal pain. You can be experiencing sudden lightheadedness or weakness or a fast, irregular heartbeat. So when it comes down to chest pain, when I end up seeing the patients that I've had stents and bypasses, everyone has a different kind of description of what their pain feels like. So some of the descriptions that are most common, it feels like you have an elephant on your chest. Other times, it just feels like my heart is being squeezed. So everyone's symptom or pain is a little bit variable, and everyone's symptom for a heart attack is actually also variable. So I wanted to go over some of the examples of other patients that have had to go in for a heart attack. Now, there are a couple different types of heart attack situations. You can have something called an NSTEMI, or you can have a STEMI. So an NSTEMI is more or less where you don't actually see any EKG changes. You don't have your heart muscle causing any type of death yet. It's narrowed, something's narrowed in your heart, and it's still very serious, and you still should have to go in. And I'll talk about the whole process with the 911 call and the cardiac arrest to kind of differentiate when CPR should be initiated or not. So going back to these symptoms, shortness of breath. So I have a lot of people tell me that all of a sudden they're just going about their daily activities, coming out of the house, going into the car. Suddenly they have a progression where they're not able to take a nice deep breath anymore. They're going to the car or going grocery shopping or just doing any of the activities of daily living that they normally do. Suddenly they start to notice that they have some shortness of breath. So it's kind of subtle. It can creep up on you. A lot of patients kind of sometimes disregard the shortness of breath, thinking that, oh, I'm deconditioned, or I'm maybe it's the air quality. This has been a common complaint, actually. Maybe it's the air quality, or maybe I have a cold, or maybe I have asthma. The shortness of breath is actually kind of a little hard to describe, because a lot of patients have sometimes the shortness of breath, and this is maybe the beginning stages of maybe having a heart attack, but not to the point where you end up having to go immediately to the hospital. The shortness of breath is like, I'm talking to you on the phone at rest, and I cannot catch my breath. And I was able to talk on the phone with no problem, but all of a sudden I'm not able to talk on the phone. Or the most worrisome symptoms, any of these on the screen that are considered a 911 call, are if they happen at complete rest. So you're sitting and watching TV, all of a sudden you start to feel really short of breath, and you're like, oh, this is kind of random. Or you wake up in the middle of the night and you start to feel really short of breath. You're kind of gasping for air. That's a really troublesome sign that these situations are 911. Same thing if you wake up in the middle of the night with any pain, pressure in the neck, jaw, back. If you start to feel like some heartburn kind of coming up. Now, the heartburn one's actually really tricky, because a lot of elderly population has what you call heartburn. And that happens at night when you go to bed, because maybe you ate a heavy meal in the middle of the night, like late at night, and you can have these symptoms. So if you have a diagnosis of heartburn, it's a little difficult to differentiate if you have a heart attack. I would imagine that you probably would have some additional symptom on top of the heartburn in the middle of the night. The fast, irregular heartbeat, that's one is a little tricky, because if you have a fast and irregular heartbeat, it's kind of hard to say, because you actually you take your hand over here and you can kind of measure your pulse on your wrist. And you might be able to notice that you have a pulse that is actually going on a regular, you have regular tapping. If it's irregular, you would hear tap, 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 maybe stop, tap, 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 stop. Or it could be a variety of different feelings that don't feel as regular. And if it's going fast, you might have associated symptoms of feeling a little bit dizzy. You might feel like you have the heart it might actually feel like a heart palpitation. So in this situation, any of these instances are a 911 phone call. This isn't something that you just jump in the car, because you may not make it in the car. Okay, so I'm going to continue to go over more about these symptoms throughout the rest of my slides. I just wanted you guys to just take a look at this. Now, women's symptoms, they're pretty vague. So from my experience, a lot of women feel like they have fatigue. They may be sweating. They have pain, especially in the left arm and in the shoulder, and sometimes in between the shoulder blades. It's super vague, their pain. It's not exactly the classic left arm pain that we have, but I also have seen female patients have it in the right arm. So it's a little bit on the spectrum of not typical symptoms. Some of the women that I've seen who have had a bypass, or they've had a cardiac event, the shortness of breath is such a common one. As women, we tend to do so much in our society, and I think that we just kind of push through and ignore our symptoms. And the shortness of breath one is a big one. I've seen it in time and time again, that's one of the main complaints, along with some vague chest pressure. That's a bit a common one as well. Now, I've been working in cardiac rehab for a little over 7.5 years. I've seen my fair share of patients, and I'll be sharing with you some of the stories that they've encountered in terms of what they've what was the progression, along with like some of the risk factors that have caused them to have these events. But I forgot to put one other important note on women's symptoms. There's a condition called spontaneous coronary artery dissection. It's called SCAD. It happens to women that are hormonal. So those who are kind of on the younger side, somewhere in their 30s up to like mid 50s. It's kind of an interesting situation because these women, they end up having the same kind of symptoms that you see up on here. It presents just like a heart attack. They have troponins, which is the cardiac marker, elevated, and it looks like it's a heart attack. And they go in with doing a cardiac cath, and then they find out that there's actually no blockage. But what it is, it's a portion of the lining of the coronary artery that has actually split off and has caused kind of an occlusion, a temporary occlusion. So, and that causes the symptoms because now the coronary artery doesn't get the blood flow. So, yeah, women's symptoms are pretty vague. I would say that if you are starting to have any type of symptoms while you are doing some activity, I would just take note, especially the shortness of breath. And if you're feeling like a little bit of pain somewhere, or lightheadedness, I would bring it to the attention of your doctor immediately. Yeah, so I'm going to go on to the next slide, and I'm going to continue sharing some stories. So cardiac arrest versus heart attack. So cardiac arrest is a little different. The heart has stopped pumping. Or it's if you do find a patient down, it could be potentially that the patient is in a arrhythmia that is difficult for it to be pumping adequately. So what you'll end up seeing in this situation is that there's a patient that collapses, you end up responding, you shake and tap them on the shoulders, and there's no response, no reaction. That's an immediate, go get help, get 911, call 911. And what would end up happening in this situation is you would immediately proceed to do some chest compressions. Now, I know that healthcare professionals are certified to do CPR, but standby people, you guys should be able to learn how to do at least some of the compressions. And that is actually guided by the 911 phone call that is made by the operator. They're going to end up instructing you where exactly what you're supposed to be doing, how fast is the rate. And I have another couple slides that'll explain to you a little bit more about the CPR, just kind of some basics. I bring this into the attention of the cardiac arrest because I've had multiple situations with patients, not just necessarily in my cardiac rehab, but patients that have already had the cardiac arrest outside the hospital. I'll share with you two stories. And they ended up having their bypass surgery, and then they ended up going through our cardiac rehab program. So first example that I wanted to share is I had a patient that was working pretty hard in a startup company, pretty young guy. I would say he was probably late 40s, early 50s. He was doing some presentation or was in a meeting. He had started to feel really clammy, really sweaty. Didn't know what was going on. All of a sudden, he started to feel like he was having some left arm pain. And then all of a sudden, he ended up going down. He turned in, his rhythm was in a ventricular fibrillation, which is an irregular heart rate rhythm. And they ended up getting immediately assistance. They had an AED in his workplace, and they called 911, and the person that found him down in the meeting, they were doing chest compressions right there at the meeting, and they were able to resuscitate him, shock him by the shocking, because the AED is extremely important to place if the patient is found to have a lethal arrhythmia, and stabilize him enough to get him into the hospital so that he can end up having his bypass. So that's one instance. I have another instance where I had a patient actually I have two more stories with that. They were husband, wife in the kitchen, they were cooking together. This was like late afternoon. Husband ends up going down. Wife freaks out. ends up calling 911 and was instructed on how to do the chest compressions. So an ambulance arrived, patient survived, got quickly back into to get to the cath lab, ended up, actually, I think it was cath lab or surgery. They ended up figuring that he probably had to have a bypass surgery. Not all of these situations end up leading to having a bypass. It just depends on what exactly happened to the heart. So it's extremely important to be able to do the chest compressions if somebody's found down, and then to call 911. The heart attack, these happen when one or more coronary arteries have a blockage, but you are still stabilized. You're not going to be down. You're not going to have an immediate cardiac arrest where you're going to be down, but it's pretty serious because it potentially can happen if you've had long-standing symptoms with activity, like the chest pain, discomfort, lightheadedness, vomiting, shortness of breath, mainly the shortness of breath and like mild chest pain that comes and goes occasionally with activity. You potentially are prolonging the heart damage in your heart, and the coronary arteries are just getting a little bit more narrower and narrower. And then it comes to a point where it gets completely occluded, or a plaque breaks and opens up and you have a complete blockage. And then in these situations, those are also 911 situations where you end up calling and getting immediately transported by ambulance to the hospital so that they can do a cath immediately on you and have medical care. So calling 911 and what to expect. So chest pain or pressure that lasts more than a couple minutes. Any of the symptoms of shortness of breath happens. You could be walking in a grocery store, all of a sudden you have crushing chest pain. And we're not talking about you having chest pain before, but just all of a sudden it's really bad crushing chest pain, or you just feel like you're so winded that you're not able to, you're not sure if you're going to quote unquote make it. That's definitely what you call a 911 phone call. You don't want to drive yourself or your loved ones with these symptoms. The ambulance is especially helpful because they have a defibrillator if needed in case you do go down, and they can shock you. They do have some medication on board that can quickly help you, like for example, nitroglycerin, if you don't have that on you. And a couple other medications like antiemetics, which are making sure that you don't vomit. They have fluids. They can actually put an IV in really quickly. They're basically trying to stabilize you before you go into the hospital. And in the meantime, they're taking you to the cardiac center where they can immediately get you checked out by a cardiologist and potentially put you into the cath lab. So I put over here as a note that you don't necessarily need to know how to do CPR, but generally, a patient or a bystander would basically go over, go into the next slide really quickly. Yeah, here we go. So should we do CPR? Why is it so important? Basically, when you are found down, your heart stops pumping. You have blood that is no longer flowing in to feed your brain, your heart, everything, like lungs. So you want to immediately call 911 or call for help. I would imagine to get a bunch of people to come out and help you, because doing those chest compressions is actually very difficult and very tiring. It's extreme work. I have here an image of two people doing on a mannequin, and basically the placement of the hands. And then this little AED device is actually very helpful, because right when you turn on the AED, it tells you, to place the plaids so they can detect if the patient has any arrhythmia. And if it's shockable, excellent. That means there's a greater chance of survival. And you want to do the CPR about 100 to 120 pushes a minute. And you should be kind of timing your pushes to the beat of staying alive. And that's basically a good way to, that song, Staying Alive, which is going that way. I read online for bystander CPR that it's more likely for the patient to survive if you do the chest compressions, just the chest compressions for right now. Their CPR for BLS and for all our providers, we are supposed to be doing a recommendation of 30-2, so you do 30. But you know what? You're out there on the field. When the medical professionals come, they're going to end up doing it correctly. Right now, the biggest lifesaver is doing those chest compressions. So I just wanted to point that out. AEDs, they happen, there are basically in a lot of the public places. I've seen them in the airports, bookstores, grocery stores, banks. We even have them in outpatient facilities, in medical facilities, if they don't have a crash cart and an actual defibrillator that you would use in the hospital. So you would basically just have somebody quickly open it and grab it and bring it with you. But it's basically whoever is working in that area, they'll know where the AED is. And during the 911 call, directions will be given, but the directions are actually on the AED. You just need to turn on the AED, and then it'll direct you where to put the pads while you're doing the chest compressions. Ideally, you're in a situation where you have additional people and that can help you and switch out with the compressions while the ambulance team arrives. Usually the ambulance, if you have somebody that's found down, they're found pretty quickly. But when I took an ACLS class a couple of years ago, one of the first responders who was teaching the class, she told me that there were somebody was found down and they were doing chest compressions for over 45 minutes. And there were multiple people that were around doing the chest compressions before the ambulance came. I think it was partly because it was in a more remote area. And just doing those chest compressions for that long without the medical professionals saved this guy's life. So I'm just, you never know where you're going to end up coming down and having a cardiac arrest. I mentioned the two examples earlier about our patients that ended up being found down in the afternoon, just in the kitchen, and then also in a meeting. So you just really don't know when this can happen. Okay, I see there's some questions, and I will get to them at the end after Jason and our presentation. So I have here a slide of what is considered a normal artery, a coronary artery. And then I also have a slide of where the plaque buildup is. So you see that it's narrowed, and you have flow that is basically inhibiting the amount of flow that goes to the actual heart. The heart muscle needs blood. And once you are obstructing part of the coronary artery that gives blood to the heart, to feed the heart, you are not able to, you'll start to feel some of the symptoms. In this situation, the plaque buildup is main contributor. And if they end up going in for a cath, they'll notice that maybe this patient has a 90% blockage. Blockage meaning that there's still some flow, but it's very minimal, patient's having symptoms. And a lot of these plaque buildups, they start really early. It happens, everybody has some plaque buildup. It just depends on how much. And what the factors are that lead up to having the plaque buildup entail basically if you have a family history, what kind of exercise you're doing, how are you eating, if you're above the age of 45 for males and above the age of 55 for females. These are the risk factors that you cannot control. So the patients that end up having coronary artery disease or heart disease, these are things we can't control. And what we're talking about today are things that we can control. But I just wanted to make sure that you guys are aware that if you do have a history of coronary artery disease, or you're of a particular gender, it does seem to be more prevalent in men than women. And the age group is actually specific. There's data. I think that number for 45 actually should be a little bit lower, because we've seen a lot of patients actually a lot younger than 45 having these cardiac events. So I've seen patients even in their mid 30s, both men and women. I think it's because our society right now is, we work really hard. So there's a lot of stress, and that's one of the things I'll address in the next couple slides. So the things that we can control, risk factors, are high blood pressure, cholesterol, diabetes, prediabetes, smoking, lack of physical exercise, an unhealthy diet, depression, anxiety, and stress. A lot of these factors, a combination of that, along with this previous slide of having things that you cannot control. The family history is like a huge piece of the pie when it comes to having coronary artery disease. You could be doing everything perfectly with your lifestyle, and something still could happen. Unfortunately, I've seen it. Usually it's like a family history and something with cholesterol, or it's a family history and maybe the diet isn't perfect. So I see a lot of patients that have had a huge family history of coronary artery disease on any of these family members, and if not the family members, like an aunt or an uncle or a brother. Okay, so why is blood pressure important for us to control? So there's huge pressure in the arterial walls and it damages the lining, leads to plaque buildup, and can lead to a blockage within the artery. High blood pressure is also known as our silent killer because usually there are no symptoms. You could be sitting comfortably on watching TV and you could have a blood pressure 180 over, 180 over 80 and feel totally fine, or 160 over 80, 84 or whatever, and you could still be feeling fine. Usually people start to feel symptoms. If it's really, really high, they may end up having a headache. That's kind of like one of the indicators that you have kind of a high blood pressure. A lot of people don't actually check their blood pressure at home, so they don't know. They end up going to the doctor's office and kind of, doing their checkup. So going to a doctor's office at least once a year with your primary care physician is extremely important, just to make sure that you're in good health and that your blood pressure and your everything's in check, at least to do that. So that's one of the main reasons why you need to make sure that you are, having a pretty good blood pressure control, because you're going to increase this pressure within the walls. And that actually is a lot of, just about every patient that I've encountered also has high blood pressure with the coronary artery disease. So some of the categories I have here, what's normal, what's elevated, what's considered stage 1, 2, and hypertensive crisis. The 180 over 120 is pretty, I mentioned that you could be sitting on the couch with 180, but I would imagine you probably also have a headache. The 140 over 90, if you have that for long standing, it's pretty, you wouldn't actually feel it. You would probably continue on with your day and not even notice that you have the high blood pressure at all. So you wouldn't even know until you go into a doctor's office and they tell you that you are in this stage 1 and stage 2. And at that point, they probably would put you on a blood pressure medication. Cholesterol is huge. Jason's going to be talking about diet. I'm just going to show you these regular numbers that are guidelines, what we would like to see in our patient population. A lot of patients have high cholesterol and their diet is not exactly controlled well. And that basically leads to that plaque that we're talking about in the coronary artery. It's cholesterol and it's basically calcified. It gets really hard in those coronary arteries. They harden because of this cholesterol. And it starts to begin with this narrowing. So these are ideal numbers. Below 200, HDL, you want it to be below 60. LDL below 100, ideally over 70. A lot of your primary care physicians will probably end up prescribing you a cholesterol agent to help you control these numbers, so that it would be in that direction. But there's a lot about the diet that can actually help you. So I'm going to leave that portion for Jason. Prediabetes and diabetes. This is also pretty huge. Diabetes, also high blood glucose levels, damage blood vessels and nerves that control your heart. Your body doesn't make enough insulin that it's supposed to. You have 90 to 95% of the patient population that with diabetes have type 2. 1 in 3 patients have prediabetes, and 85% of those patients don't even know that they have prediabetes. So we use a marker called Hemoglobin A1c. Usually we would want to see our patients below 5.7. That's a really good number. I have another slide for that. The prediabetes below 5.7. And if you did a fasting blood sugar test, that would be 99. And we have the glucose tolerance test where they give you a bunch of sugar to drink to see how well you do and how well your pancreas is able to handle the amount of sugar, and if the insulin is going to be secreted properly. So fasting blood sugar test, you can be fasting when you wake up in the middle of the night, or you check it in the morning first thing without having to eat. And you can do one of those finger pricks and you see that it's 99 and below. However, it's kind of variable. It could be also 100 to 125. If your doctor is concerned, they will end up giving you a glucometer, and they'll end up teaching you how to they'll send you to a diabetes education center where you can end up learning more about how to check your blood sugar. But at the stage of prediabetes, no medication is typically given, not even the meter that I'm talking about. They basically want you to have diet control. And that's another topic where Jason will end up going more into. So yeah, this is a huge thing to be able to control if you have diabetes. I saw a question about how diabetes can actually, if it's uncontrolled, can lead to a diabetic kidney nephropathy. So it actually can impact your kidney if you don't have a well-controlled diabetes situation. If you have it long-standing, you can end up injuring your kidneys. And then in those cases, sometimes the kidneys cannot be saved, and then you end up having to be on dialysis. So yeah, I think I'm going back to the notion that it's important for you to be seeing your primary care physician at least once a year. Lack of physical exercise. We want our patients to be, actually everybody, general population, American Heart Association, 30 minutes, 5 times a week. We're not talking about something crazy. We're just talking about going for a walk. There's a lot of incidences where you end up having higher blood pressure, heart attack, stroke, and other related problems because of lack of exercise. Some of the things that are important to be aware of, that it improves your cholesterol. Hands down, exercise improves your cholesterol. It also decreases the amount of sugar you have in your blood. So there you go. You're able to actually control and prevent yourself from getting into a diabetic situation. You're improving efficient oxygen delivery. You're decreasing the workload on your heart. And it's basically effective all in all. Your mood, everything. Exercise is the key, people. I can't be so much more of an advocate for exercise, for not just cardiac patients, but for everyone to just go out there and exercise. I think it's ideal. I think we would have much healthier population if we were able to adhere to exercise, not just 5 days a week, but every day. Okay, the other one that I don't see very often, but I do have patients coming in, is smoking. It damages the lining of your arteries, increases that plaque buildup that you saw in the coronary artery, raises triglycerides, lowers the good cholesterol. You have a great chance of decreasing your risk of coronary artery disease or having another cardiac event if you stop smoking within 1 year. 50%, that's pretty huge. And 20% of heart disease deaths are accounted just for smoking, including secondhand smoke. So if you're smoking, please quit. It's not doing you anything. Unhealthy diet. I'm going to kind of leave this one for Jason, but diet has everything to do with everything. If you put on extra weight, your joints end up hurting. You are building up more plaque buildup. Your blood pressure goes up because of the salt and sugar is going up, and that could potentially put you into a diabetic state. Just diet is huge. So I'm leaving that for Jason. Also mood disorders, anxiety and depression. So anxiety and depression, I don't know if they've been addressed so well. A lot of patients end up having anxiety and depression after their cardiac event, but they also have it before their cardiac event. And a lot of patients that have cardiac events also suffer, at least 20 to 30% of them have depression. And the same thing happens with anxiety. So I would say that if you're feeling depressed or anxious, go get that help, go see a psychologist. And if you don't feel like doing that, then go talk to your primary care physician and see if you can go about getting yourself put on something to control yourself. Yeah, so I think that these are two aspects that are not exactly addressed. Okay. Stress is a huge one. I've mentioned the younger patient population having stress, and that's probably one of the bigger risk factors to having a cardiac event. You have all these causes right here. This gentleman here is clearly stressed, probably a developer because we live in the Bay Area. But yeah, controlling stress is huge. Stress relief top suggestions. I really like going outside. I really believe in forest bathing, just being out there in nature to actually calm your nerves and being able to absorb any of the energy that is available to you in nature. Meditation and deep breathing is something that I actually swear by. I do them on a daily basis in the morning and in the evening. Slowing down, doing things that you enjoy, keeping calm. So this is, I think, the end of my presentation. I'm going to hand it over to Jason. If we'll answer all the questions at the end. Thank you.
Thanks, Michelle. Hard act to follow, but happy to be here with you. And as Michelle has been talking about, she and I are very strong believers in the power of lifestyle interventions in keeping people healthy and recover, both prevention and recovery from issues like heart disease. I'm going to focus on the way that food both can play a healthy role in your life, but also, address specific conditions and issues that Michelle has brought up. I'm going to use a couple of very well-studied, proven to work dietary approaches, and one famous food writer to get into some of the details here. So I'm also, I'm going to keep my eye on the clock, but I've got a lot of information in here about what's happening inside the body as well. So this is going to be both a little bit about physiology, how we eat affects the functioning of our organ systems, obviously with a focus on heart health, but also practical information. How do you implement some of these things? And I did see a chat question, which was, a good one, right? And it's something that as a dietitian, we really have to focus on, which is that there's a lot of information out there about nutrition. Very easy to find opinionated comments, suggestions, dietary approaches. It's a huge industry, and it can be difficult to really know what to trust or what to believe. So, this person is asking about these specific diets like vegan, vegetarian, Mediterranean, keto, Pritkin, processed versus fast food. So we could go. I'm sure all of you could list a lot of other things too. And so I'm hoping that by the end of today, you're going to understand some of the basic guidelines that most, let's say all successful approaches to eating will have in common. So I do want to launch one of my polls as well. Let's see if I can do that. Okay, so there's no right answer to this question, but I want to hear what you guys think would be the most important thing that you could do for your heart health in terms of nutrition. And while you're answering that, I'm going to just mention a couple other things that hopefully I'll have time to talk about. I'm going to really focusing on this concept of keeping your arteries healthy. So how you eat can play a big role. And Michelle, identified things like plaque and cholesterol in the blood that has an impact on arterial health. Inflammation, the impact of body weight. So nutrition has a big, of course, role there. If you need to, losing weight, what are the recommendations around that? We'll talk about that. And a little bit about the microbiome as well. So this is an area that's, there's definitely some more growing research right now about. Yeah, and we've got about 64%. So keep going on that poll, and I'll get back to it once I have a few more answers. So in terms of arterial health, we can think about, our arteries are not just tubes, right? They're living tissue, and they have cells that we want to keep healthy. And what you eat, how you move, how you manage your stress, all these things that Michelle has mentioned are powerful tools at your disposal to help with that. Anything that damages the artery walls, you can also think about this as inflammation, is a risk factor for heart attack. So an ideal diet is one that will help you control all the factors that Michelle has talked about, LDL cholesterol, HDL, blood pressure, triglycerides, another part of the common cholesterol panel that we look at. And this, the benefit here is that we want that endothelium, those cells, to be healthy, but also that we want the arteries to be flexible. So when they need to expand, they can. When they need to constrict, they can. They're not stiff. That's the thing we want to avoid. Okay, so let's see, I'm going to close the poll. Looks like it's pretty close, but eating predominantly plant foods got our highest score. Limiting sugar was the lowest one. This may have been hard for you to pick. If you'd asked me this question, I might have agreed with you there in terms of the eating predominantly plant foods, but really the answer depends on you. So this is part of, we can say nutrition should be personalized to a certain degree. We have, and I'm going to talk about, the common guidelines, as I mentioned, which don't change. And we know a lot about how nutrition impacts heart health, and you can customize it. So, for some, salt might be the key thing if you have high blood pressure. For others, if blood sugar control is not good, you have high insulin levels, then maybe sugar is more important. All right. Thank you for indulging me and keeping interacting a little bit with the poll. So in 2010, sorry, my poll just popped back up. The American Heart Association convened a panel of experts to look at creating a strategic plan for reducing cardiovascular disease in the US. As Michelle mentioned, it's the #1 cause of preventable death in the US, has been for a long time. So looking over, tons of research, the committee came up with these seven behaviors for reducing the risk of heart disease. And I'm obviously focusing on the eat right part. How you eat impacts the blood pressure, cholesterol, blood sugar, and of course, body weight. Michelle already mentioned most of these as well, the smoking, and I will reiterate, you probably saw me nodding if you're looking, when she was talking about exercise, essential. We can't overstate the benefits of that. Okay, so I'm going to talk about the DASH diet, as I mentioned, and the Mediterranean diet. And the DASH diet, dietary approaches to stop hypertension. So it's right in the name, blood pressure, right? This is a really #1 diet for many people who study the impact of nutrition. This is the one they recommend. We hear a lot about the Mediterranean diet. It gets a little bit more buzz and more press, but they're both well studied, both really work quite well. If I were to ask you, what is the thing about the DASH diet? Like, what is the DASH diet? If you knew or saw that the hypertension was in the name, you'd probably say low sodium, which is true. That's part of it, but it's much more than that. And that might be why it's not as popular, because it's a little bit, people think, oh yeah, salt, I get it. We know that. But really it follows, both the Mediterranean and the DASH diet follow this healthy eating plate, which if you are as old as I am, you may not have learned in school. We all learned the food pyramid. This is the new food pyramid, much more helpful and I think useful for sure. And this plate is from Harvard School of Public Health, as you can see on the slide. This is one of the sources I recommend for learning, keeping up to date with nutrition, learning more about nutrition. It's called the Nutrition Source. You can see that on the bottom there. So both the Mediterranean and the DASH diet, they are predominantly, I should say, predominantly plant-based. I like that phrase. So, all of you who picked that as the #1 intervention, these two diets agree. They are, both of them also, help us to control things that can increase heart disease risk, like high intake of saturated fat, processed foods in general, excess sugars, refined carbohydrates, these kinds of foods that we know can overwhelm the body a little bit when you eat too much of them. So I'm going to talk a little bit more about how much is too much in a minute. So again, the DASH diet, a little bit more of a focus on sodium and low fat. The Mediterranean diet, this might be one of the reasons why it's also a little more popular. It doesn't really restrict fat as much, but the quality of the fat is very important. So as I said, both of them do restrict the amount of saturated fat, and that is the high fat meats, processed meats, red meat we call it. This is beef, pork, and lamb. So very similar in that way. Slight variation in the percentage of calories from fat, essentially. Just so you know, as a reference point, the average American eats about 35% of their calories from fat. So this isn't really that different. What is different is, again, the source and the quality. Okay, so a little bit, I'm going to include some numbers as we go through, but so I want you to understand how impactful these changes, if you follow these dietary approaches, can be. Following the DASH diet can help lower blood pressure, but also lowers the risk of diabetes, some cancers, promotes strong bones, healthy skin. So, whenever we're talking about nutrition, like it's focusing here, of course, on heart attack prevention, heart health, but the heart is not in isolation, obviously. Whatever you're eating to improve heart health, it's going to rebound for the rest of the body as well. So, Michelle mentioned the kidney playing a role here. So again, same, we might tweak the diet a little bit for people who have kidney disease, but essentially you follow these healthy dietary principles and it's going to benefit every organ system in your body. Okay. So let's do a little bit of focus on blood pressure. Salt, right? That's a common number, probably the top thing you can do to keep your blood pressure under control, to prevent and even potentially improve blood pressure if you do have high blood pressure. So this is going to be our second poll, just to give me a sense of if this is something that those of you who are watching pay attention to. And I'm going to guess that you do, but I'm just curious. But salt intake is not the only thing that has an impact on blood pressure. So whenever I talk about nutrition, I like to, both say, what should you eat less of, but also what should you eat more of, right? So we can think about food as medicine almost in some ways. So in this case, blood pressure, sodium, potassium, and magnesium all work together. These are electrolytes. They work together in the body to help us control fluid balance and blood pressure. So high potassium foods, high magnesium foods, these really help to promote healthy levels of fluid in the body and blood pressure. Additionally, eating too much at once, so these large portions, feeling very full or fatigued after a meal, that can also put a lot of strain and pressure on the heart, raising blood pressure. Okay, maybe not surprising. The vast majority of you do pay attention to, or at least try to limit salt in your diet. Oh, I might have forgotten to share the results last time. Sorry. Here it is. Okay. Oh, and getting back to that focus on the arteries. So not only does eating excessive salt, create this high blood pressure that we've been talking about, but it also can promote that stiffness that we want to avoid in the arteries. While plant foods that have lots of antioxidants, anti-inflammatory compounds, these all promote that healthy endothelium that is very pliant and contract and work well as needed. Okay. So some of the numbers in terms of sodium, in case you don't know, and this is a big range, this 1500 to 2300. This is an individualized part of this too. So your doctor may, if recommending a low sodium diet, could give you that number that you want to shoot for. You don't want to go too low. We need salt. It's an essential nutrient in the diet. 1500 is generally the lowest that we'll recommend. This may not be surprising to you, but something like 90% of Americans consume too much salt in their diet, and the average intake is 2 to 3 times what is recommended, as you can see on this slide. One study showed or estimated that if Americans followed the guidelines on sodium, that we could prevent or decrease the incidence of hypertension by 25%. So this can have a huge impact on health, without a doubt. Most people, when I talk to them about limiting salt in their diet, will say, I don't eat a lot of salt. I don't put salt on my food. That's sort of how I know that I'm not eating too much, which unfortunately doesn't really work, because the vast majority of the salt that we eat as a culture, as a nation, is not from the salt shaker. It's salt that's already in the foods that we're consuming. So this is salt's a bit of a tricky thing. Sometimes you know, and you can tell if food tastes salty, but other times you can't. So you have to be a bit of a detective, educate yourself a little bit, just to know where, some of the hidden sources of sodium in the diet. And in studies of salt intake in the US, they've identified 6 foods that contribute nearly half of the salt that Americans consume. So these are the 6, according to the American Heart Association. And one of the interventions that they recommend for decreasing sodium or following a low sodium diet is to limit these 6 foods, to really focus on reducing those in your diet. As I said, sometimes high sodium foods don't necessarily taste that salty, so it might be surprising to us that they are. And I think, this number one source being bread is often quite surprising to people. And part of the reason for that is that bread does have a reasonable amount of sodium in it. It's that we eat a lot of it. So as you can see, it kind of occurs several times here. The top 3 things all do have bread in them, pizzas, sandwiches as well. So you can see how pretty quickly that can add up. So I'm not saying here that you can't eat bread. Bread is not an unhealthy food. It's really about how much you're consuming. How much is enough? How much is too much? So if you're having, toast for breakfast, a sandwich for lunch, and then bread with your dinner, you're going to get a lot of salt from that. Okay. So let's talk a little bit. So I've been talking about salt, obviously, but sugar is also something that can affect blood pressure, but also the health of that endothelium that I've been discussing. So let's look into a little bit as to why that is. Michelle's already talked a little bit about diabetes, but outside of that, the sugar that you eat, regardless of whether you have diabetes or not, has an impact on your body. Elevated blood sugars also can cause damage to blood vessels and the organ system. And this can, if it's the heart, if it's the kidney, the liver, potentially, this can also affect blood pressure. So these are fast absorbing sugars in the food, added sugars in the diet. So what can happen here is that you consume something like, say, ice cream or cookies. If you eat enough of it, it very quickly can spike your blood sugars. This can also cause triglycerides to go up, insulin as well. All 3 of those can have damaging effects on the body. And I'm going to talk more about cholesterol in a minute here. Sugar in excess is also pro-inflammatory. So another way that too much sugar can have an impact. And I didn't show the poll results, but that first question I asked, sugar was the fewest votes. So the next couple of slides, you can see if maybe you might change your mind on that. So I mentioned insulin. So insulin is a hormone that is released when we have carbohydrates or really any food. It helps to take blood sugar into the cells. If you eat too much, if you get your blood sugars too high, then insulin goes too high. And if you know what hormones are, they're really just chemical signals. They affect everything in the body. They don't, just target one thing. So we think of insulin as it's actually a growth hormone as well. And that can cause excess fat deposition. So too much insulin in the body means we shuttle the calories that we've consumed and we store it as fat. And usually we store that fat in the belly. That's often what happens with high levels of insulin. It increases this visceral fat you can see on this slide. When I'm not talking about the sort of belly, roll that might hang over your waist. It's the one that's inside, that kind of like bowling ball or beer belly that you might think of, which stereotypically, with men. And this is the fat in the body is not inert. It's not just hanging out. It actually is an active tissue, releases its own chemicals. And when they're close to the organ system, as you can see the visceral fat here, then it can cause problems, creating problems with blood pressure, increasing risk for diabetes, some forms of cancer, putting more pressure on the heart again. So there are many, many studies about the impact of high blood sugars on health, increasing the risk for death and disease, to put a fine point on it, I suppose. And of course, high levels of blood sugar can put you at risk for prediabetes and diabetes, essentially, or eventually. People with diabetes, as Michelle pointed out, 4 times more likely to die from heart disease. So really is something to pay attention to. And we just saw how insulin is associated with visceral fat. It also is pro-inflammatory, again, driving that inflammation level, damaging the endothelium. Okay, so a question I often get is, okay, so sugar, does it mean 0? Can I never have it? And the answer, kind of like with bread that I mentioned, is really about quantity. So figuring out how much is too much for you, there are some guidelines, and I'm going to go through what those are, but give you a few examples of how easy it is to get way too much, just like with salt. So study, this was out of the Journal of the American Medical Association, about the connection between heart disease and sugar intake. So here you can see, just 1 soda a day over time. Obviously, this takes decades. We're talking about lifestyle diseases, chronic diseases that develop over time. So increased heart disease, dying from heart disease by 1/3. More than twice as likely to die from heart disease if you eat the most versus intake of 10 teaspoons per day. So this isn't terribly restrictive. There is still potentially room in a healthy diet for treats, sugar sources as well. But it may not be from a soda, at least not a 20-ounce soda. So here you can think about, I don't have a poll for this, but you can think about how many teaspoons do you think are in a 20-ounce soda, remembering that the recommendation is for limiting your intake to 10 teaspoons per day. Higher or lower than that, it's quite a bit higher. So that 20-ounce soda has nearly 1.5 times essentially the recommended amount. And I think most of us know, right? Soda, not healthy. But sugar, a little bit like salt, can be hidden sometimes too. And we don't always know how much is in it or think of certain foods as being high in sugar. Things like a grande non-fat latte from Starbucks has 8 teaspoons of sugar in it. So if you're aiming for 10 and you have 2 lattes, you've blown through that number right there. Things like smoothies can also be sources of added sugar. I'm going to talk about the difference between fruit and fruit juice in a minute, but some things to look out for sure. Okay, so the World Health Association recommends that we keep our intake of sugar below 10% of your total energy intake. And this is basically 6 to 8 teaspoons per day, depending on how much you consume. So a little bit more restrictive than the American Heart Association. And these numbers are, about 40 to 50% lower than the average intake of most Americans. So just like with salt, lots of room for improvement in terms of these nutrients. Oh, let's see, sorry. There we go. There's the average intake of about 20 teaspoons per day. Okay, so we move on to a little bit about cholesterol. So Michelle mentioned and had a slide also on the plaque in the arteries being a problem, and I'm going to talk a little bit about LDL cholesterol in particular. So we really want to keep that number low. Michelle mentioned that 100, even 70 maybe, depending on your health condition. So I already talked a little bit about saturated fat. I also want to talk about fiber in regards to cholesterol. And here's where I'm going to do the eat more, eat less kind of thing again. So these are the foods that you want to include in your diet. Many of these are the healthy fats that I was talking about. Mediterranean diet has a lot of these in them. I'm sure many of you have heard about omega-3 fatty acids. These are anti-inflammatory fats in food. We get them from the salmon, as you can see on here. You can get them from some plant sources as well, things like walnuts, as it mentioned on the slide. Now, fiber, this is where the predominantly plant part comes in. Most Americans consume about half as much dietary fiber as they should. So this half number is coming up a lot. Again, seeing that we're falling short, not just on our exercise recommendations, but for sure on the dietary ones as well. All plant foods have fiber. It's pretty easy. Eat more of those and you'll get more fiber, and that will help lower your LDL cholesterol. In particular, and I've listed a couple of these foods on here, soluble fiber and pectin. Pectin's another nutrient, call it, or compound that's in plants, and specifically a lot of fruits have that, things like apples, citrus fruits, carrots as well, some vegetables. So both soluble fiber and pectin play a role here in that they can trap cholesterol and carry it through the body. So I think that can be really useful for us. And here's the eat less part. So I've already mentioned saturated fat. These are the red meats. You can think about the size of your palm. That's about 4 ounces. And you want to do that no more than twice a week. Processed meats, as little as possible. I've seen some recommendations for 2 ounces once a week, maybe, but really has a lot of potential health problems with processed meats. And here's another study showing the dramatic impact of diet on health risk. So you can see decreasing levels of LDL by changing how you eat. I'm just looking at the time. I think I'm always more ambitious than I have time for when we do these slides. So I think what I'll do is kind of skip through these a little bit. So here's some, I want to mention, this was in the chat, somebody asked, can we see the slides? And we're going to be sharing these with you. So some of these very specific, like how to follow these diets information is going to be in the slide for you, and you can get those. Twin's going to help us figure that out. I want to make sure we have time for our question and answer as well. This is that Michael Pollan. Hopefully you know this quote: "Eat food, mostly plants, not too much." This is the very simple, succinct, as he's always very good about doing, way of following a healthy diet. Okay, so I'm gonna skip forward just because I want to mention actually there's an easier way to do that, the microbiome a little bit. Like I said, this is an area of increasing research, and these are basically just the bacteria that live on and in us, vastly outnumbering the cells in our body. Huge role in digestive health and potentially in reducing the risk for heart attack. There's something called TMAO, and this is a byproduct of bacterial digestion of specific amino acids in our diet. And there are studies that show people who have high levels of this TMAO circulating in their blood are at higher risk for heart attack because it impairs the function of that endothelium. So we really want to pay attention to things like this. And the TMAO comes from choline and carnitine. These are the amino acids that I was talking about. And this is mostly found in animal meat. So this might be another reason why we see that people who have reduced their intake of high fat meats have more, shifting more towards plants, have lower risk of heart attack.
So a lot of these questions were asked during the registration. So when you were registering on Zoom and some of you had the option to feed us questions before the presentation, these are them. So pros and cons of cardiac catheterization. Michelle answered, it depends on your medical history and your age. The cardiologist will be able to help determine if a cardiac cath, aka cardiac catheterization, will be in your best benefit. DKD, that was something submitted during the registration, and Michelle wanted to clarify this if you meant diabetic kidney disease. If so, patients that are diabetic are at higher risk for heart disease. Kidney disease also impacts heart disease as blood pressure is not controlled. This is regarding high blood pressure. How important is hereditary as a risk factor? It's huge, according to Michelle. You'll want to make good lifestyle choices. All the factors that you can control will be what you'll want to focus on preventing a cardiac event occurring. Another person asked, if exercise is good, how do you know when you're pushing yourself too far? Michelle thought this was a great question. You have to listen to your body. You should start slowly. Ask your doctor first if it's okay to exercise. But if you are given the okay by your doctor, then going for a walk where you're able to talk with no problem is a good indicator that you are not working too hard, but you're still doing something. If you walk faster or go up an incline and your breathing is heavier, that's exercising. And when you're exercising, it's expected for your breathing to be elevated.
Going on to the most common symptoms for women, I think that was asked twice. So I'll just answer it again. Fatigue, vague chest pain, shortness of breath, among other pain felt in the shoulders, arm. Every female patient that I've come across has a different kind of sensation. So, but this is what I've commonly seen. So I hope that helps. And we have another question regarding, I have high blood pressure with sometimes reactive BP incident, tips to reduce risk. Everything that Jason and I have presented on today basically can help to reduce and help you with high blood pressure. My other follow-up question to that is, are you on medication and are you being followed by a physician? That would be my other two things I would like to follow up on. So if you'd like to, you can respond to this question, or I can see how I can help.
And Jason, if you have anything to add to this question, feel free.
Yeah. So going on to the next question, pains that occur in the heart lasting only moments, every signs of heart disease or an imminent heart attack, what are the tests that I should seek? So I kind of briefly mentioned that you can have chest pain that happens with activity, and that if it happens momentarily and it goes away with rest, that could be considered stable angina. I would recommend having you immediately tell your doctor that you're having these sensations. and lasting just a few moments. And, they probably will end up referring you over to a cardiologist, and then that cardiologist or the primary care actually would immediately do like some labs and then do an EKG. And then I'm not sure if the primary care can do an exercise stress test, but I would imagine that might be something that they would be interested in doing. If not the primary care physician, it would be the cardiologist. So that would be what I would anticipate. Signs for folks with type 2 and non-diabetic folks, how to prevent it and what to do, food recommendations. I think Jason's presentation is huge in this. Diet's huge along with exercise. The symptoms that I mentioned regarding like throughout the entire presentation, it just isn't just for type 2 diabetes. They're all very similar. They're all very different. So I don't have anything specific like if you're type 2 diabetic, you're for sure going to end up having shortness of breath, or you're going to end up for sure having jaw pain or something. So it varies from person to person, and what I've presented with the symptoms, it can happen to just about anyone in the population with whatever diagnosis they have. Risk factors and other options for high blood pressure not reduced by meds. Basically, everything we presented on today. However, if you still have blood pressure and you're doing everything perfectly and your blood pressure is still high, that's the conversation you have with your physician. They may end up placing you on a blood pressure medication. It's kind of hard to avoid. There are a lot of people out there that don't want to be on medications. I hear you. Nobody wants to be on medications. But if you have high blood pressure and you're not having it controlled, you can either put yourself at a risk for a stroke or having a cardiac event happen to you. Nerve tingling and in the arm versus arm sensation. So this is a little hard for me to actually answer. Everyone's sensation is a little bit different. I've heard something that I feel something going on in my arm, to tingling, to actual numbness when they end up having the actual heart attack incident happen. Everyone's symptom and sensation is just about different. And if it is actually long-standing and it's going on for like a long time, I would actually end up thinking that it might be a nerve damage or a neuropathy. But again, this is something that you should address with your physician, especially if you're having long-standing arm numbness. But in the situation in signs of a heart attack, I would say that if you're having a sensation and it's unusual for you, that is considered something serious. Why are there so many heart attacks? Oh, it's a great question. My answer to that is that as a society, we are just not able to have a perfect lifestyle. We either go to our vices, we drink our alcohol, we smoke, we eat our sugar, we don't exercise, we watch TV. Just about everything that we've presented on, it would be helpful in making sure that you wouldn't have a heart attack. And I think that as a society, the stress, anxiety, depression, everything that we've just described right now, that's all what is a contributing force to us having so many heart attacks in the US. And I'd imagine the same thing worldwide. How can I tell if it's chest tightness or heartburn? So heartburn, you usually feel a stomach acid kind of going up into your, from your stomach all the way up through your esophagus, and it kind of can go to your chest. And it can be feeling like a burning sensation that people who have gastroesophageal reflux disease, also known as GERD, they end up having this frequently. Usually they're told not to eat heavy meals before bed. Usually they're also told to eat at least 3 to 4 hours before going to sleep, because these patients who have this symptom with the acid reflux will suffer during the night. So you would, if you do have this, you would follow up with your physician and possibly put it on a medication, or maybe do some lifestyle diet changes. Diet changes are huge in controlling this is acid reflux. And heartburn, chest tightness, you'd feel a little bit of squeezing. However, if you've never ever had this acid reflux in your life before and you're not diagnosed with it, and all of a sudden you have severe heartburn, this what I'm describing right now as burning sensation going up to your esophagus, and you just never had it before, that would be considered something life-threatening and could be considered a heart attack sign, and you would call 911. What do we have here? A burning sensation. We'll be definitely sharing slides when we'll send it out to you guys. And then I have some remaining questions that I'm going to have Jason answer if he can. Thank you so much.
Yeah, I know that it's a little bit of a lightning situation. So yeah, well, we'll just get started and I won't try to take up any more time.
Okay, yeah, so yeah, thank you for the questions about nutrition. We'll start off with, are eggs bad for cardiovascular health? It's a good question. You'll see changing dietary recommendations sometimes. This is one of those areas where, for a long time we thought, oh, the cholesterol in food causes our cholesterol to go up in our blood. That connection did not prove to be quite so strong. So the recommendation on restriction for eggs has been reduced, has been lightened. And I think the best advice I've seen, this can depend on your cholesterol numbers, but really somewhere less than 7 per day is usually a decent one to watch out for. Eggs do have saturated fat in them as well. So it's not a free food necessarily, but can be a good source of lots of nutrients in the diet, good source of protein, many essential fatty acids as well. So salt and sodium, and sorry I didn't explain this before, in terms of nutrition, we use them interchangeably. Technically they're not the same thing. Table salt, which is what we refer to as salt, is sodium chloride, of course, you know that. But on nutrition labels, and when I talk about numbers in terms of milligrams of sodium recommendations, it's interchangeable. Someone was advised by their provider to try Jenny Craig or Nutrisystems to lose weight. So I didn't really get a chance to talk too much about weight loss. Lots of approaches out there. What's the best approach to losing weight? It depends. Like when they do studies on, say, a low carb diet or a low fat diet, which one works better for weight loss? They all work about the same. The key is, can you follow it? Will you stick with it? And what do you do when you're done? So it's not a diet that you do temporarily. Well, in some kinds it can be, but if it's a diet you can't follow forever, which I think Nutrisystems and Jenny Craig would fall into that category because they're, kind of like meal replacement sort of approaches. You really need to put just as much energy, if not more, and attention into what are you doing when you're done? How are you going to eat for the rest of your life, essentially, to keep that weight off? 80% of people who lose weight on a diet regain it plus some. So they don't just go back to their pre-diet weight, they actually go higher. So both those diets can work, but you have to really watch what happens afterwards. This is a good question. We're in a food-saturated environment. How do we control our diets when it's so difficult in our culture? Agribusiness is relentlessly trying to sell us processed foods. So yeah, we live in a processed food environment. We call it an obesogenic environment, meaning it promotes excess body weight, excess calorie consumption. Foods are designed to trigger your taste buds, to taste good, to make you want to eat more, to make you want to eat too much. Those same foods don't keep you full very long, meaning you eat a lot of it, you want to eat more very quickly afterwards. Soda is a really good example of that. Our body doesn't register liquid calories like it does solid food. It's almost like I didn't consume any calories when I drank a soda. That's what the brain thinks, when in reality you did. And as we saw with those, how many teaspoons of sugar are in things like Starbucks drinks, really we should be thinking about Starbucks like it's fast food. Like this is not just coffee. You can get coffee there, but that's not what most people do. We all know that fast food is unhealthy. In my opinion, we should be thinking about Starbucks that way too. So what do you do about this, right? You can opt out. Don't buy processed food. Don't go to fast food. Don't go to Starbucks. Make your own food. The number one thing you can do for your health, cook more. That can be hard though, right? So cooking takes time. It takes energy. It takes resources that some people don't have. Maybe you don't know how. So that, that's a long-term solution for many people. Figuring out how to make some of your own food yourself. Take control of feeding yourself. Don't rely on agribusiness, big food, fast food companies to feed you. Sometimes we have to for convenience. We're in a very busy society, but sorry, this is an important topic to me. So taking control of your food, how you feed yourself, watching your portions when you do eat these kinds of things matters, so they're going to feed you too much. Don't eat as much as you're fed. Is the keto diet healthy? Sometimes, maybe, probably not. If you have heart disease, no. Too much fat, right? Raises cholesterol, raises triglycerides. There are some interesting studies on people who have diabetes using the keto diet to help control blood sugar. So, I think in the right situation, done healthfully, can work, but it's a dangerous one to play around with, especially if you're worrying about heart attack risk.
It's going to also just mention that it's a big one for cholesterol too. That elevates your cholesterol if you're on a keto diet. I don't know. I have mixed opinions about it. Jason actually ended up mentioning the diabetes, but yeah, definitely it has some studies for diabetes being well controlled while being on a keto diet. But I don't know. I would think that you would have to be monitored by a physician if you're going to be doing such a diet. It's a little risky.
I see that there are two questions, and one of them we already partially answered in the chat. What is an unhealthy diet? Vegan versus vegetarian versus Mediterranean versus keto versus Pritikin versus processed food? And I think that you mentioned processed food, fast food in the previous answer, and maybe you can add to that, Jason, if there's much more.
Yeah, sure. Just the vegan, vegetarian. These are predominantly plant-based, although vegan Oreos are vegan, Coke is vegan, right? So, again, quality of the food matters. Like whatever dietary approach you choose, Mediterranean, Pritkin, there's not a processed food diet that we'd recommend, but it should limit those things, right? And it should have quality, wholesome ingredients. And I see the last one. What are your thoughts on intermittent fasting for weight loss? Intermittent fasting is really one that's getting a lot of attention right now. There was a time where almost everybody who talked to me was like, I'm trying the intermittent fasting. So it's another one that, done right, can benefit people. I find with my patients that some people respond well to it and some do not. So it maybe depends on genetics, personality. I don't know exactly what the component is, but there's again, it's an interesting area of research, and this idea that you really limit or expand the amount of time that your body has without getting food stimulation is it's theoretical right now, but some interesting possibilities there. And I do use it sometimes with people, and sometimes it does help with weight loss. It's not easy though, and it's not necessarily practical. It can be hard to socialize and eat out when you're doing this. It's relatively restrictive on when you eat. But if those are things you want to do, then it can be done. Kind of like with what we're talking about with keto though, because you're eating this is another version of restriction in the diet. When what you do eat matters very much. So if you're only eating, say, 2 meals a day because you've restricted and you've cut out a meal, those 2 meals become more important. What you choose, you got to get all your vegetables into 2 meals now instead of 3. You got to get all your fiber in there. So you really have to put some more emphasis on choosing healthy foods when you are eating.
Mm-hmm. I was going to say one more thing. I noticed that I didn't answer one of the questions on the Q&A, so I wanted to address 2 more questions, if that's okay. And I also wanted to thank Jason for doing this presentation with me today. I think that we have a lot of valuable information that needs to be shared, and Twin for letting us be your presenters.
I'm the one that's really appreciative.
So last 2 questions I just really quickly wanted to address before we, I guess, end. I have missed the question, could men be more likely to have heart attacks because their incidents are better studied and understood? Yes and no. There are a lot of studies definitely done on men in the 50s, 60s, 70s regarding heart attacks. But, there has been a prevalence of men just in general having over the age of 45, they're much younger when these incidents happens. There are more studies still coming out on heart failure, which is another whole topic that I didn't even talk about, but and heart attacks that are being continuously done, and they're being printed with the American College of Cardiology. And yeah, there's a lot of studies out there. And then there's another personal question regarding atrial flutter. And I do recommend this person to go see a cardiologist if they haven't been already followed. It's very rare. So just talking about this irregular AFib, A flutter, very, I don't see it very often, but sometimes it could turn into another rhythm. But more importantly, it's just making sure that you are maybe on a blood thinner. I'm not sure. I think it's a conversation to have with your cardiologist. If you don't have a cardiologist, go get one. It's a complicated rhythm. And last thing I want is somebody end up having a stroke. So yeah, I would definitely go and see a cardiologist. So usually it's presented with some kind of palpitations that are irregular. And sometimes you have symptoms, sometimes you don't. Sometimes you actually feel a little lightheaded. So yeah, I think it's definitely something to follow up with. So I just wanted to address that because it was kind of a serious question.
Thank you so much for being thorough, Michelle.
I was going to say something else. One more thing. I actually work in the cardiac rehab. I haven't exactly explained what I do. I do see patients post-event. I mean, I've been talking about what to do, what not to do, but just a quick brief. I work at CPMC in the Mission Bernal campus, and it's a new location for us. It's very small. We have a gym, and we work in conjunction with the Diabetes Education Center, with the CHRC and health psychologists. Like I mentioned, I've been there for about 7.5 years, and I see a variety of patients that have had their, heart failure all the way to having a heart transplant, to valve surgeries, bypass surgeries, and stents placements. So if you know anybody that is interested, you can shoot an email. I have my personal email there because I also do some behind the scenes stuff that's not related to work. If you have like to be added to an email list, please let me know. I'll be sending out some other information. That's my own personal thing. But yeah, I'm very happy to be working with all of you.
Thank you so much, both of you. We really hope that everyone who participated felt like they got a comprehensive answer Q&A session. And if not, please send us an email. Thank you, everyone. Thank you, Jason. Thank you, Michelle.